Hello everyone, welcome once again to our YouTube channel. Today we are going to discuss about anatomy of clavicle. Clavicle is a long bone. It supports shoulder so that the arm can swing clearly away from trunk. The bone has a cylindrical part called shaft and two end. It has two end, lateral and medial end. This is the clavicle. It is the long bone. It has a cylindrical part called shaft and there are two end. One is medial end. It is also known as sternal end because it articulates with the sternum, and another is lateral end, that is also known as acromial end because it articulates with the acromial process of scapula. How to do side determination of clavicle? There are 3 points on which we can determine whether it is bone of right side or left side. First point is the lateral end is flat and medial end is large and quadrilateral. You can see in this image this is a quadrilateral type of size, and this is a flat, this is a lateral end, and this quadrilateral part is medial end. The second part, the shaft is slightly curved so that it is concave forward in its medial two-third. In the medial two-third, the shaft of the clavicle in its medial two-third, it is convex forward, and lateral one-third, it is concave forward in lateral one-third and convex forward in the medial two-third. And the third point is the inferior surface is grooved longitudinally in its medial one-third. It is groove which is present in inferior surface. So on the basis of these 3 points, we can determine whether this clavicle is belong to right side or left side. In this diagram, you can clearly see this is a quadrilateral type of size, this is medial end, and this is a flat, this is a lateral end, right? Medial end is also known as external end and lateral end is also known as acromial end, right? And another point, you can see that it in medial two-third it is convex forward, and in lateral one-third it is concave forward. And in third point, you can see there is a groove which is present in inferior surface. On these 3 points we can do side determination. What are the peculiarity of the clavicle? It is the only long bone which lies horizontally, which is the most important point you have to remember. It is the subcutaneous throughout. It is the first bone to start ossify. It is the only long bone which ossify in membrane. It is the only long bone which has two primary center of ossification. And there is no medullary cavity. It is occasionally pierced by middle supraclavicular nerve. Shaft. The shaft is divided into two parts, medial two-third and lateral one-third. Medial two-third and lateral one-third. Lateral one-third of shaft is flattened from above downward. It has two border, anterior border and posterior border, superior surface and inferior surface. Lateral one-third of the shaft has two border, anterior border, posterior border. Anterior border is concave forward. It is concave forward. Anterior border is, and posterior border is convex forward. Posterior border is concave convex forward. It has two surface, superior surface and inferior surface. Superior surface is subcutaneous and the inferior surface present an elevation called conoid tubercle. It is conoid tubercle, and there is a ridge called trapezoid ridge. You can see clearly. There is two border, anterior border, posterior border. This is superior surface, this is inferior surface. In inferior surface there is a tubercle called as conoid tubercle, and there is a ridge called trapezoid ridge. This is all about lateral one third of clavicle. Clavicle lateral one third has two border, anterior posterior. Anterior border is concave forward, posterior border is convex backward. Two surface, inferior surface. Superior surface is subcutaneous, and inferior surface have tubercle, conoid tubercle, and ridge trapezoid. Medial one, two-third. Medial two-third of shaft is rounded and is said to have four surface. Medial two-third have four surface. Anterior surface, posterior surface, superior surface, and inferior surface. In inferior surface, there is a longitudinal groove called subclavian groove, and nutrient foramen lie at the lateral end of the groove. This is the picture of medial two-third. It has four surface: superior, inferior, anterior, and posterior surface. And in inferior part there is a groove called subclavian groove. Nutrient artery lie lateral to the subclavian groove. This is all about medial two-third. It has four surface: anterior surface, posterior surface, superior surface, and inferior surface. Inferior surface have subclavian groove, and it has two end: lateral end or medial end. Medial end articulate with sternum. It is also known as sternal end and form sternoclavicular joint. Lateral end articulate with acromial process of scapula, so form acromioscapular joint, acromioclavicular joint. Attachment. Lateral end give attachment to the joint capsule of acromioclavicular joint, and medial end give attachment to the joint capsule of sternoclavicular joint. And the attachment of lateral one third of shaft. The anterior border of the lateral one third give origin to deltoid muscle, and the posterior border of the lateral one third give insertion to trapezius muscle. You can see in this picture clearly. The conoid tubercle and trapezoid ridge give attachment to the conoid and trapezoid part of coracoclavicular ligament. The conoid tubercle and trapezoid ridge which is present inferiorly. Medial two-third. Medial two-third, the most of the anterior surface give origin to the pectoralis major. Anterior surface, medial two-third have four surface: anterior surface, posterior surface, superior surface, and inferior surface. Anterior surface give origin to the pectoralis muscle, anterior surface. Superior surface give origin to the clavicular head of sternocleidomastoid muscle, superior surface. Inferior surface give attachment to the costoclavicular ligament. Inferior surface give attachment to the costoclavicular ligament, right? And the subclavian groove give insertion to subclavius muscle which is present at the inferior surface, right? Posterior surface close to the medial and give origin to sternohyoid muscle, and posterior surface give attachment to the sternohyoid muscle. Posterior surface give attachment to the sternohyoid muscle, posterior surface. Inferior surface give attachment to the costoclavicular ligament. Anterior surface give attachment to the pectoralis major, and the superior surface give attachment to the sternocleidomastoid muscle, clavicular hand. Thank you very much for watching this. I hope you all understand this. If you like, please subscribe and share this channel. And if you want to know more anatomy, you can subscribe our channel.